Welcome to this COVID vaccine town hall. Thanks for being here, and I'm sorry I can't be with you live, but I am grateful to be able to welcome you and to provide some opening remarks. First of all, I want to start by thanking a few people. Dr. Luke John Day, who has led us tirelessly through this pandemic and has stepped forward to ensure that we are ready to receive the vaccine and to provide it to you. I also want to thank Elaine Decker, Dr. Lisa Winston, Dr. Vivek Jain. They have also really led us through this pandemic with their incredibly knowledgeable infection control, infectious disease leadership to help us understand and manage this pandemic in a way that we could never have done without them. I also want to say that we are just at an incredibly pivotal moment in time. The COVID pandemic looms larger than it has at any moment since February 25th, when the mayor first declared a state of emergency in San Francisco due to this disease. The most recent numbers in San Francisco from a couple of days ago are that we have more people hospitalized in San Francisco than at any other time since the pandemic, which is incredibly worrisome. Our most recent projections are that in San Francisco, we could actually run out of ICU beds at the end of December and acute med-surg beds shortly after that time. We know that in the short term that this shelter-in-place order that was put into place earlier in the week is the best way we can respond to the surge. And basically what it means is that we all need to stay home except for essential errands and coming to work here at the hospital. Don't gather with people outside of your own household because this is the way the disease is primarily spreading at this time. Don't travel. Avoid crowds except for essential errands that need to be done. And follow the guidance that we all know, which is wearing a face covering, keeping your distance from other people, washing hands. These are the most important things we can do now. And very excitingly, we know that we are on the precipice of receiving vaccines for healthcare workers, especially and for residents of long-term care facilities. So you all on the front line are going to be in the first group of people to be vaccinated. This may start as early as next week. That's what we hope and expect. So we wanted to get information out to you as soon as possible and get all your questions answered. And just know, this is the very definition of flying a plane while we're building it, so we appreciate your patience. We will vaccinate everyone here who wants to be vaccinated. Hopefully that will be all of you. And our plans are to be equitable, to be transparent, to be based on data, science, facts, and the guidelines we receive from the federal and state government. So thank you so much. And let's get going with the town hall and with vaccinations.